I'm Dr. Gregory James Hummer. I'm a trained trauma surgeon and the CEO of Simplicity Health Plans. We're in a big mess in the United States today as it pertains to healthcare, in particularly health insurance. And this short series of videos will help you understand how we got to that situation. 4 factors account for 70% of the chronic disease in the United States: high blood pressure, cholesterol, overweight, smoking. 8 out of 10 Americans today are relatively healthy and will spend no more than $700 to $800 in a year, and that includes families, which means the other 2 out of 10 spend most of all the resources that we have available. Currently, our healthcare expenditures are well over $2.2 trillion. This video will consist of 3 main components. The first will be the history of healthcare and how we got into this mess. The second will pertain to how to fix it. And the third will be information about Simplicity Health Plans and how we can offer a solution to the problem. Thank you for watching the videos, and I hope you enjoy them.
By the late 1930s, several large insurance companies entered the health insurance business. The success of these large for-profit insurance companies was attributed to their ability to negotiate fixed-fee contracts for their clients in exchange for reduced prices and guaranteed payments. This was especially attractive to the hospitals and doctors given the financial hardships of the Depression era. The greatest leap in group health insurance occurred during the Second World War. As our young men and women went off to war in the African, European, and Pacific theaters, those who remained at home found themselves rationing all kinds of things that contributed to the war effort, like gas, rubber, food, and clothing. To control inflation, the U.S. government imposed wage and price controls upon the nation. Wage and price control offices were set up in towns and cities throughout the country. Government employees monitored corporations, and as part of their daily routine, would check pricing in local shops to enforce wage and price controls. Because wages were frozen during the war, employers found it difficult to attract new employees and to keep good employees, especially because they could not give them raises. As a way to get around the wage and price controls, employers began paying employees' medical bills and health insurance premiums. They also improved the benefit packages to include new medical services. After the Second World War ended, it was virtually impossible for employers to take back what they had already given their employees. Health benefits were here to stay. They became part of the American way of life and a political football, especially between the unions and corporations, and between politicians who did and did not want socialized health care. It's important to note that before World War II, the vast number of people in the United States were responsible for their own health care and had to pay their own bills. The U.S. government generally frowned upon taking responsibility for the individual in society. In fact, before the Second World War, very few corporations offered health insurance.
Thank you for watching this segment. Be sure to tune in to the next clip.